We were engaged by the Federal Ministry of Health way back in 2017 to support the government on the project called the Basic Healthcare Provision Funds. They wanted states across Nigeria to have access to quality first and then affordable local pharmaceutical products. One of the questions we asked, why can't you do that yourself? Why do you need an intermediary? And it seemed like there were key issues which really looked at trust. So they needed someone in the middle. RKSM plays what I call the government whisperer, meaning we understood really what government was saying, and we knew how to communicate it to companies, engaging with leaders in the local manufacturer sector, dealing with this issue called trust, to come to the point where PMGMAN signed an MOU with ACK, then ACK Nigeria, in 2018. Brokering that partnership for us has been significant. We started this with one state. Currently, we're in 11 states. We're looking at ramping up partnerships to like 20 states. Why? The country has adopted a new policy, which is the Group Purchasing Framework policy. And what is this Group Purchasing Framework? We're looking now at, instead of individual states doing business with companies, states are coming together to pool their volume together. What that will do is that the cost of medicines will really go down, particularly for those life-saving commodities across the entire Nigeria. When you deal with manufacturers directly, you can then identify where there are quality issues. But if the hospitals are going about engaging different vendors, they may not all have the capacity to tackle the issue of quality. This partnership has actually impacted the business of local manufacturers to the point that within almost, I think it was 2 years or 1 year, there was 5% turnover increase in their business. They consistently said, well, we are ramping up manufacturing. We are increasing the scope of our manufacturing. Why? Because government has over time started doing good business. I call it good business when you keep to the terms of the agreement. Consistently became a buyer. And what that does is, as governments are buying, the companies now see more range of demand. Now they are manufacturing for health, public health of the nation. That's quite significant. This universal health coverage through medicine equity is a reality, and we can all achieve it. That means everybody must be part of this. That means if you are not already part of the PPP, you need to jump on this wagon. That's what we're talking about, having one lens. That means we need everybody on hand.